The Final Health Revolution. One quote from Andrew Taylor Still really kicked off my whole journey. He said, "The object of a physician is to find health. Any darn fool can find disease." Those words triggered a set of intuitions and ideas that it's been difficult for me to put into words. It started with the question, well, if I'm supposed to be finding health, what is health exactly? And it turns out it's the capacity to do something worth doing. But out of that question grew a worldview that has put me on a very different path of practice. And even in these early years, the power of this new worldview on my patients' lives has been extraordinary. I started this channel to share as much of that as possible, and I hope that it will eventually reshape how all of healthcare is practiced. But all of that will take some time. In the short term, by the end of this video, I hope to share concepts that will help you find your health. Hi, I'm Dr. Zain Hakeem. I'm a physician, board certified in internal medicine, and founder of RiverRock Medical Clinic in Austin, Texas. I started RiverRock to explore my belief that I could do more than just help my patients manage diseases. I could also help them to find health. But as I've tried to share these ideas with family and friends and patients, I've realized that I've come to see healthcare so differently, that my worldview has shifted so much that the explanation of what I do is no longer simple or straightforward. In this video, I'd like to share what my practice and this channel are all about. In order to do that, I'd like to walk you through a 3-step process that I hope will let you see the landscape of medicine, wellness, and health the way that I see it. Step 1. As we start on the first step, let's begin by considering the context of modern medicine. I still practice in hospitals and ICUs, and I see firsthand the amazing things we can do in acute and critical care. The power of scientific and medical innovation, diagnostic testing, pharmacology, and surgery has transformed our world over the last 100 years. And I practice in the hospital to keep my skills and familiarity with all the tools of modern medicine sharp and ready. But I also see the limits of those advancements. Human beings are still mortal and must wrestle with that mortality. Diagnostic testing has errors, pharmaceuticals have side effects, and surgeries have complications. And as an internist, and especially as an internist who likes mathematics and statistics, I have a deeper appreciation than most for the nature of those errors and flaws and the ways that we can and cannot effectively compensate for them. The brilliant success of antibiotics created the dream of a pill for every condition, and the massive technical innovations of surgery made us dream of being able to repair or replace any part at any time. These successes created a new medical culture, a culture of doing more, and in critical care, that culture is exactly the one we need. But outside of the ICU or operating room, what we need is often the opposite. Say you've been battling a cold for 5 days, you're achy, tired, coughing, congested, the whole 9 yards. You hop online and someone's like, hey, you should get some antibiotics from your doctor. So you go to your doc and you ask for a Z-Pak. Now, almost by definition, any doctor that gives you a Z-Pak in that moment is not being a good doctor. Instead, a good doctor will take the time to explain why an antibiotic is not the right answer. And people struggle with this because the doctor is not saying that some other medicine would be a better option. The doctor is saying that no medicine is the best option, that doing nothing is the best option. This truth runs counter to our culture of do something and do it fast. We have to carefully teach medical students to counteract that cultural tendency using a few clever quotes and aphorisms. One of them is, the best medicine is to do as much nothing as possible. Another is, the role of the physician is to entertain the patient while nature effects a cure. Or my favorite, which we tell to students who are overprescribing or overdoing, don't just do something, sit there. Nonetheless, the right solution often creates conflict with patients because it runs counter to the cultural narrative that there must be something we can do. There often isn't. Some doctors cave just to avoid conflict and hassle and prescribe the antibiotic, even though they know it's wrong. Good doctors will try to explain why an antibiotic is not the right solution, although they are hampered by the time crunch of the insurance-based assembly line. Better doctors may even try to go a bit further and discuss the larger patterns of your illnesses, how often you're getting colds, are there things you could optimize in your sleep or your exercise habits to reduce the frequency that you get colds, while recognizing that that frequency will not hit zero. Getting a cold is a fundamental, natural, normal part of human existence and has been since the dawn of time. This step, where we pursue truthful, realistic, limited optimizations, is step 2 of the RiverRock pathway. And then there's step 3, which no physician that I know of is addressing, and that is where I believe the magic of RiverRock comes in. But before we get to step 3, let's clarify more fully how this analogy relates to longevity, wellness, and the overall concept of finding health. Once we understand the current context of the massive success in treating diseases with pharmaceuticals, nutritional supplements, surgeries, vaccines, imaging, and blood work, it becomes natural to understand why modern medicine would try to extend that success using those tools and methods to prevent disease. It's also understandable how snake oil salesmen would try to gain fame and fortune by recommending that we use these tools just more aggressively. After all, it would seem these tools are the scientific tools, and it all sounds very advanced and very numerical and precise. So instead of the regular normal range of blood work, why not just aim for a tighter, narrower, more optimal normal range? Instead of just scanning a few body parts when there's a problem, why not scan the whole body ahead of time and keep scanning it early and often? Why not, in other words, just do more? Despite being understandable, it doesn't work. And in fact, if you really understand the science, it can't work. And so on this channel, I spend a lot of time diving into the details of how medical testing and treatment really works so we can debunk the fake health gurus who abuse the mantle of science with what I call quantified quackery. And make no mistake, it's not that they are wrong and I have a better protocol or supplement. It's that they are wrong and there is no magic supplement. Their entire notion that health can be optimized via protocols, supplements, and blood work is fundamentally, irretrievably, mathematically flawed, just as an antibiotic can never treat a virus, no matter the dose, timing, or route. So this is step 1, realizing that what got us here won't get us there. We cannot simply repurpose the tools of disease detection and treatment and apply it to finding and promoting health. The second step in this thought process continues our analogy. Just as the better doctor could work with the patient to optimize whatever could be optimized, same in the longevity space. There are some real things that will significantly improve and optimize our expected longevity. Understanding and optimizing those few things, and then accepting that there is nothing more, is the goal of step 2. And what are those things? VO2 max, strength, social connectedness, don't smoke, and maybe manage your blood pressure. There are maybe 4 or 5 other things if you really squint at the data, but there aren't many. It's not 20 or 40 things that you can do to optimize your longevity. And furthermore, each one of these optimization targets has diminishing returns as you improve it. So just getting to the 95th percentile for each one is largely going to maximize your longevity and health span. Moving from the 5th percentile of VO2 max for your age to the 90th percentile will have outstanding benefits. Moving from the 97th percentile to the 99th percentile will have minimal, trivial benefits. This is equally true for all the other real longevity optimizations. And again, we can reiterate here that the list is short because most things don't work. Yes, that includes the protocols and supplements promoted by the wellness influencers, but it also includes things promoted by standard medicine. Standard medicine does have many good treatments for disease, but as we discussed in the beginning, we are trying to find health. For example, neither mammogram screenings nor prostate cancer screening options have been shown to reduce mortality. There are no cardiac screening options other than VO2 max that reduce mortality, especially not coronary calcium scores or preventative stents. Being more advanced doesn't help either. Whole body MRIs don't reduce mortality, nor does optimizing other meaningless labs like homocysteine, nor does targeting more optimal levels of the usual labs, whether that's hemoglobin or testosterone. If you're not getting the idea, the humbling truth is that almost nothing really works for longevity, except the very few things that I mentioned before. We need to accept that despite companies and influencers' claims, and even standard medicine's desire to be seen as the hero, very, very, very few things actually improve longevity. And the things that do are the simple, basic things that are hard because they require diligence and consistency, not brilliance or innovation. So these are the first 2 steps. First, we have to understand the science behind modern medicine deeply so that we correctly understand its limitations. We can then clearly and firmly reject the quantified quackery of the ignorant longevity charlatans selling snake oil. Once we've done that, our minds will be cleared of the bullshit lure of an easy, certain answer, and we will be able to focus on step 2, acting on the few truly effective methods of longevity optimization. VO2 max, strength, social connectedness, avoid smoking, and manage high blood pressure, as well as managing diabetes or any other diseases you may already have. And then there's step 3. As we learned in step 1, we can't simply repurpose old disease-focused tools to find our health. Here in step 3, We're going to shift our entire viewpoint to see what the new tools might look like, to discover what we even need those tools to accomplish for us. To start to take step 3, let's go back to the guy with the cold. He's annoyed, grumpy, he feels ill, and wants someone to do something. He wants something to make him feel better, and usually, in our culture, he wants it now. Marcus Aurelius wrote, "Stick with the situation at hand and ask, why is this so unbearable? Why can't I endure it?" You will be embarrassed to answer. The notion that you absolutely require some form of urgent intervention or treatment in response to having a cold for 5 days is indicative of a psychological area in need of growth. It's indicative of a character deficiency. That's a harsh message, but it is one deeply connected to the reality of medicine and biology. In the longevity space, this analogy continues. Why do so many people think that aging and death require some sort of intervention? Why is death so hard to accept as a reality? Why can't you accept it? If you look inside, you'll be embarrassed to answer. Our guy with the cold will be best served by radically accepting that he has a cold, it's almost certainly a virus, and that it will take 10 to 14 days to get better, sometimes longer. Once he has radically accepted this, he can focus on changing his subjective experience. He can care for himself in the ways that he finds best. Maybe some ginger tea or some cough drops, saltwater gargles, or watching reruns of Friends. He can prioritize rest and do the inner work of recognizing that some discomfort is a natural and appropriate part of life. There are downtimes in life, and we very often don't have control over them. Similarly, once you can radically accept your mortality instead of struggling futilely against it, you will become immune to charlatans who are playing on your fear to sell you snake oil. Once you stop looking for the impossible, you can focus on maximizing what's actually possible. And even more importantly, you'll know when enough is enough, when your efforts on step 2 have reached the end of the list, and it's time to focus not just on longevity optimizations, but the real health optimizations. And what are the real health optimizations? To understand that and to complete step 3, to fully come into the RiverRock worldview, I turn to a humorous example from marketing expert Rory Sutherland. Here he is in his inimitable style.
You know my example of the Eurostar. £6 million spent to reduce the journey time between Paris and London by about 40 minutes. For 0.01% of this money, you could have put Wi-Fi on the trains, which wouldn't have reduced the duration of the journey, but would have improved its enjoyment and its usefulness far more. For maybe 10% of the money, you could have paid all of the world's top male and female supermodels to walk up and down the train, handing out free Chateau Petrus to all the passengers. You'd still have £5 billion in change, and people would ask for the trains to be slowed down.
The deep insight here is that the psychological, the subjective, is far more important and powerful than the objective. No matter how much money you spend, you will not make that journey 10 times faster. But you could easily make the journey 10 times more useful and enjoyable by adding Wi-Fi. Or supermodels. We have reached that same point of diminishing returns in longevity in medicine. Performing some convoluted, unproven protocol every day for years just to extend your lifespan by 6 months is pointless, even more so if it requires the sacrifice of your joy and meaning. We've been fixated on extending the objective length of our lives, partly because we implicitly assume that life has a certain amount of depth and meaning. Meanwhile, social and technological changes have progressively conspired to rob us of that depth. Consequently, we continue to focus on trivial improvements in the objective duration of life, rather than putting our efforts toward reclaiming and maximizing the subjective depth and meaning of our experience. The goal should not be to maximize the length of life alone, but to maximize the area of life, the product of both the length and the depth. In many circumstances, it may be worth it to you to trade off a few years of life if you could significantly increase the meaningfulness and depth of your experience. Things like parenting fall in that category, or Olympians who are looking for a gold medal and are willing to tear up their bodies to do so. You've heard of lifespan and the popular term health span. I call this MeaningSpan, the optimization not just of duration, but the combination of duration and depth, both the length of life and the meaningfulness of life, creating a framework for embracing the necessary trade-offs that exist in that optimization. Now, optimizing MeaningSpan is complicated. There's a lot to it. Certainly pain and discomfort lower the quality of life, but oddly enough, pleasure doesn't increase it. Meaning and purpose, growth and fulfillment increase the quality of life, but these can often require the voluntary pursuit of even more discomfort, difficulty, or even suffering. And of course, the natural changes of aging can cause reductions in quality of life, and changing the slope of those reductions, changing the final depth, is a worthwhile endeavor, even if there's no change in the outright duration, because it would improve the area of the shape. As I mentioned before, optimizing MeaningSpan, the area of this rectangle, embraces the trade-offs that occasionally occur between meaning and duration of life. But of course, depth of experience, meaningfulness, and fulfillment are hard to measure, and our culture is obsessed with what Rory Sutherland calls measurebation, the endless goal of optimizing measurable metrics, even if what really matters can't be measured. And so the door is open to the quantified quackery of the longevity charlatans who encourage you to make the unwise trade-off, sacrificing the opportunity to maximize the depth of your life for trivial increases in meaningless biomarkers. But are there reliable ways to increase that depth? That's where I believe the psychological explorations of people like John Vervaeke, and I hope my own RiverRock methods, can show their value. Yes, of course I run VO2 max tests and strength tests on my patients, and I coach and help them to optimize those. Of course I treat blood pressure and diabetes and prescribe all the normal medicines for treating diseases. But most importantly, I'm hoping to help patients identify the ways of being in the world that individually fit with your unique nature, to optimize the depth and meaning of your experience. For some, that will be experiencing the connectedness of family. For others, it'll be making an impact on the world. Or for others, it'll be just discovering some new truth, regardless of its impact. And for others, it'll be expressing their soul in art. For yet others, it will be participating and contributing to a community, collecting beautiful experiences, or exploring deep intimacy. Whatever combination of modes will enhance the depth and meaningfulness of your life, we can explore and strategize how to optimize for that, where the potential upside is nearly limitless. And so, as you explore the channel, you'll see these 3 steps, sometimes mixed, sometimes separately. Step 1, breaking down the false longevity narrative of charlatan health influencers and their quantified quackery by deeply understanding the real science of modern medicine, including its limitations. Step 2, embracing the true longevity optimizations and accepting the fact that there are only a few and no more. And then, level 3, maximizing MeaningSpan by carefully, intentionally engineering our subjective experience of life by building meaning, wisdom, purpose, discernment, character, and identity. Those 3 together form the core of what this channel, in my practice, are all about. To get started, check out this video.